Irritable bowel syndrome IBS is an gastrointestinal disease. Look at this picture, shows that large intestine, CT finding, MRI, detail going on. Introduction. Irritable bowel syndrome is a common gastrointestinal disorder that affects the large intestine. It is characterized by chronic abdominal pain and altered bowel habits without any detectable organic cause. IBS is a functional disorder, meaning the symptoms are due to the way the gut and brain interact rather than any structural abnormalities. Definition. IBS is defined as a chronic functional gastrointestinal disorder characterized by recurrent abdominal pain or discomfort associated with altered bowel habits such as diarrhea, constipation, or combination of both. The symptoms must be present for at least 3 months with symptoms onset at least 6 months prior to diagnosis. Types. 1. IBS with constipation. Predominant symptoms of constipation. Second, IBS with diarrhea. Predominant symptoms of diarrhea. Three, IBS with mixed bowel habits. Alternating symptoms of constipation and diarrhea. 4. IBS unclassified. Symptoms that do not fit into the above categories. Causes. The exact cause of IBS is unknown, but it is believed to result from combination of factors. 1. Abdominal GI motility. Irritable muscle contractions in the intestine. 2. Visceral hypersensitivity. Increased sensitivity to pain in the gastrointestinal tract. 3. Brain-gut interaction. Dysfunctional communication between the brain and gut. 4. Infections. Previous gastrointestinal infections may trigger IBS. 5. Gut microbiota. Imbalance in the intestinal microbiota. 6. Genetics. A family history of IBS may increase the risk. 7. Psychosocial factors. Stress, anxiety, and depression can exacerbate symptoms. Risk factors. 1. Age. IBS commonly affect individuals under the age of 50. Gender. Women are more likely to develop IBS. 3. Family history. A family history of IBS increases the risk. 4. Psychosocial factors. Anxiety, depression, and other mental health issues 5. Diet. Certain foods can trigger symptoms. Complications. 1. Chronic pain. Persistent abdominal pain can affect quality of life. 2. Mental health issues. Anxiety and depression are common in IBS patients. 3. Nutritional deficiencies due to dietary restrictions and malabsorption. 4. Impact on daily life. IBS can interfere with work, social activities, and overall well-being. Pathophysiology. The pathophysiology of IBS involves multiple factors including 1. Abdominal GI motility, irregular or slow muscle contractions in the intestine. 2. Visceral hypersensitivity, increased sensitivity to pain and discomfort in the gut. 3. Altered brain gut axis, dysfunctional communication between the central nervous system and the gastrointestinal tract. 4. Intestinal inflammation, low grade inflammation may contribute to symptoms. 5. Altered gut microbiota, imbalance in the gut microbiome. Signs and symptoms. 1. Abdominal pain, cramping or egging pain, often relieved by bowel movements. 2. Altered bowel habits, diarrhea, constipation, alternating between both. 3. Bloating and gas, a feeling of fullness and excess gas. 4. Mucus in stool, presence of mucus in the stool. 5. Urgency, a sudden need to have a bowel movement. Diagnosis. 1. Clinical history, detailed patient history and symptom assessment. 2. Rome. 4. Criteria. Diagnostic criteria based on symptoms. 3. Exclusion of other conditions. Rule out other gastrointestinal disorders. 4. Laboratory test, blood test, stool test and other investigations to exclude other conditions. 5. Image studies, colonoscopy, sigmoidoscopy or other imaging test if necessary. Nursing diagnosis. 1. Chronic pain related to abdominal discomfort and cramping. 2. Anxiety related to chronic illness and uncertainty about symptoms. 3. Impaired bowel elimination related to alternating diarrhea and constipation. 4. Deficient knowledge related to lack of information about IBS management. Disease management. 1. Dietary modifications, high fiber diet, low FOD MAP diet, avoiding trigger foods. 2. Medications, antispasmodics, laxatives or antidiarrheal medications, antidepressants for pain relief and managing anxiety, probiotics. 3. Lifestyle changes, regular exercise, stress management techniques. 4. Psychological therapy, cognitive behavioral therapy, CBT, counseling. 2. Medications, antispasmodics, laxatives or antidiarrheal medications, antidepressants for pain relief and managing anxiety, probiotics. 3. Lifestyle changes, regular exercise, stress management techniques. 4. Psychological therapy, cognitive behavioral therapy, CBT, counseling. Treatment. 1. Medications to manage symptoms such as pain, diarrhea and constipation. 2. Dietary changes, tailored diet plan to reduce symptoms. 3. Psychological interventions, managing stress and mental health. 4. Alternative therapies, acupuncture, herbal remedies and biofeedback. Psychosocial medicine, addressing the psychological aspects of IBS is crucial. Stress reduction techniques, counseling and therapies like CBT can help manage the emotional and psychological impact of IBS. Prevention. 1. Healthy diet, maintaining a balanced diet with adequate fiber. 2. Regular exercise, physical activities to promote regular bowel movements. 3. Stress management, techniques such as meditation, yoga and relaxation exercises. 4. Adequate hydration, drinking plenty of fluids. Conclusion. IBS is a chronic condition that significantly affects quality of life. Understanding the complex interplay of factors involved in IBS along with comprehensive management plan can help alleviate symptoms and improve patient outcomes. Effective management, including dietary modifications, medications, psychosocial support, and lifestyle changes tailored to individual needs. Thank you. Have a nice day.